So what we did in this is we drilled down a little bit further into that question and asked the specific activities within asked about the extent to which the specific activities within this gear are enacted. So this shows the results for the first gear, for the analytics and population insights that we're discussing, right? So each stacked bar is one attribute or one specific activity within that gear. And the blue line shows the mean scores for each one of these attributes, right? So we see the first stack bar is using clinical administrative data and conducting descriptive analysis with EMR data, for example, or other data sets. We're at about a 3 there. So the mean says we do this sometimes. Patient-reported data analysis, a little bit higher, 3.29. Qualitative data analysis, a little lower, 2.43. So in between, we're starting to do this, and we do this often. So similar range. And Walter is adding that this is a pilot result. This is, yes, this is results taken from 2 pilot studies. Correct, 100 and plus respondents have completed the survey so far. Data modeling, that pertains to predictive analytics and machine learning. And so a little bit more advanced techniques and in data analysis, equity analysis, ability to whether or not we're systematically identifying inequities through our data, and then engaging with partners across these analytic activities. And then the colors illustrate the variability of answers, right? And so typically it indicates the percentage of respondents who indicated each response type. And so red, let's just say, to simplify, red is typically bad, we're never doing this, and blue is good, we're doing this more often, right? And so this type of data visualization can help us identify which are the specific areas within the gear that we're not doing so often, and to help prioritize what it is that we want to get better at, right? And so whether or not we want to improve data modeling in the short term or using AI and predictive analytics and machine learning is something that the team can debate, whether it's a short-term or long-term goal. But certainly equity analysis, for example, was something I would recommend this sample of participants to focus on. We have 43% saying that we never do this, 1.71 mean, so we're in between, we never do this, getting close to starting to do this, but not quite at 2, right? So that would be something that this team could focus on based on this type of analysis.
Yeah, thanks a lot, Victor. And these are sort of being brought here as exemplary of the ways we could ask this in our Chair Health team. So we just asked you the very general overview question, but actually there are more detailed. And so you can see the more difficult to do things are happening a little less frequency, at least in our pilot studies.